Hi, I'm Quincy Quinlan, Director of the Health and Benefits Services Department at the Texas Association of Counties. The department administers the health pool on your behalf. We're really excited about putting on this webinar for you to let you know about the renewal and the new changes that will be taking place for plan year 2020. For those who are new, let me give just a few facts about the pool. It is county-owned and county-governed. It is an interlocal organization, which means counties came together to form the pool, and counties joined by signing an interlocal agreement. As such, it is not for profit. As a result, there are no stockholders to satisfy. And along with the fact that there is no state premium tax, we believe that those provide us several financial advantages that we can pass on to our members. Speaking of members, we have 221 presently. Of those, 212 are fully pooled and 9 are self-funded. We cover about 48,000 lives, and our primary goal is to stabilize the rates for health care for our members. Unlike an insurance company, which would provide your renewal based solely on your results from the last year and would have to satisfy premium tax and the stockholders' requirements, we have none of those, and our primary goal is to make sure that we smooth out the ups and downs of healthcare costs. As you know, healthcare is very expensive. We're currently expecting a trend north of 7% this year, but as you will hear as you go through the renewal, most of the groups will be getting something less than that because our goal is to smooth out those highs and lows in the healthcare world. As we go through the webinar, you will hear more facts and data-driven information from the other presenters. But I wanted to start the webinar by giving you a holistic view of what we are trying to accomplish. Yes, this is providing health coverage, and yes, we're very concerned about cost ratios and loss ratios, the cost of health care. But the goal that I see for the pool is we're in an environment where healthcare costs are running 3 times the rate of regular inflation. And if you've ever heard me speak at a TAC conference, you know I've said for some years now, this is not a sustainable path either for the nation or for TAC and for our members. And so what I'm going to talk to you about is something I believe very passionately is the solution, at least for the TAC health pool and our members, and that is wellness. I know some of you are groaning because you think wellness is something ancillary that people do in cute jumpsuits, but the truth of the matter is wellness is loss control for health. Most of you know about the loss control efforts that the task risk pool puts on for the property coverages, the law enforcement coverages, etc. Well, wellness is loss control for health. And just yesterday I read an article that began to show the link even more strongly between what we eat and the incidence of cancer. Why am I bringing this up? Because routinely, year after year, cancer is one of our top 3 diagnoses. And I'm saying even something as dramatic as cancer is very much influenced by our lifestyle. And so that brings me to talk about Healthy County, the TAC Comprehensive Wellness Program. And we're really trying to get buy-in from the commissioners, courts, the elected officials, as well as all of the employees to begin to understand that what we do in our personal lives drives the cost that the county sees in terms of the contributions. And so we're urging you as we go through this pre-webinar renewal to be our spokespeople back at the county to say, you know what, folks, it may be a private matter, what we eat, what we drink, how we live, how much we sleep, and all of that, but wellness is going to be of tremendous importance as we go forward. If we're going to try and hold down the costs for our members, then we need the members to work with us, and joining Healthy County and participating in Healthy County is going to be a tremendous way to do that. What do you get when you join the Healthy County program? We have 5 wellness consultants, each with a master's degree in wellness, and they're all charged with coming out to the counties, examining what's going on with the county, and partnering with you to create a consultative plan that would hopefully result in changes in lifestyle that would then reflect in lowering of the claims. We've got Sonic Boom, which is our wellness platform, and you can do steps tracking and other challenges. We have employee empowerment trainings, and then we have an annual conference, our boot camp, at which the wellness coordinator and wellness sponsor from each group can attend without cost. The TAC Health and Employee Benefits Pool has a comprehensive suite of products that we offer to our members. The foundation is, of course, the medical and prescription plans. The medical plan has its administrator as Blue Cross Blue Shield of Texas. And a quick word as to why we choose Blue Cross and Blue Shield of Texas. Not only is it the largest health insurer in Texas, but it has demonstrated in public filings compared to the other large insurers in Texas that its network performs the best, that it gets the best discounts from the doctors and hospitals. And so that when you partner with the TAC Health Pool and you get the Blue Cross network, you can guarantee that across the state, the costs are going to be lower than through any other insurance company. On the prescription drug side, as many of you know, we switched to Navitus. And while we had some growing pains, I can tell you that we are excited at TAC about the Navitus change because from a financial perspective, it has produced dramatic savings, and we will speak directly to those in terms of data as we go through this pre-renewal webinar, and you will hear how it has dramatically impacted your renewal. Then we have dental with or without orthodontic coverage. We also have a retiree medical program, and we have 2 providers that do that. We have life insurance, basic, which the county provides to the employees, and supplemental, which the employees can purchase on their own. We have disability coverages, short-term and long-term, and we also have vision insurance. Also, I'd be remiss if I didn't remind folks of the Erosity program. We're really high on that. That's the solution that we're finding for musculoskeletal issues, necks and backs and hips and knees. And the testimonials that we're getting from our members about Erosity has been fantastic. And so look forward to hearing more about that during the webinar.
All right, thank you, Quincy. Everybody be looking for Quincy at one of the regional pool workshops coming to an area near you this fall. But we're going to go ahead now. I'm Charlotte Collins with the Health Benefit Services Department here at TAC. And with me today is Brian Neiser, our Financial Manager, and Lisa Lindenberger, our Eligibility and Reporting Manager. So we're going to talk to you about the renewal. I know you're all really excited to hear about what's coming. Brian's going to be talking to us about the financial aspects of the renewal. So Brian, tell us, how does the renewal process work?
The renewal process starts with determining the overall amount needed to fully fund the claims and the fixed costs. So we work and consult with our actuary in determining the projected claims to close out fiscal year 19, these last 5 months of fiscal year 19, and we project the claims for plan year 20, looking 20 months into the future, because plan year 20 doesn't end until December 31st of 2020. We also look to the actuary to help determine the trend that we would use for those claims. Trend is the medical inflation. So if all things are equal and you have the exact same claims in plan year 19 as you do in plan year 20, you can't expect those to be the same, because there's going to be some inflation that impacts the actual cost. We also look at the fixed costs. Those are things like the fees that we pay Blue Cross and Blue Shield for administering our claims, the customer service that they provide, the network administration that is used. While the pool is fully funded, we do use Blue Cross on the back end to do all of that administration. So we look at the fees, and then the last thing we consider are any credits that we should apply. We had a lot of changes in plan year 19, and with those changes there could be some impact on the claims and the utilization, and do we need to account for that and make some adjustments. Once you do all of those things, project your claims, assess the trend, confirm your fixed cost, make any credits, then you get your overall needed amount.
Oh, okay. So what is there anything that's not included in the pooled amount?
Sure. As a non-for-profit, member-owned association, there are some fees that aren't included in that pool needed amount. That includes fees like, of course, profit margin, which is not included, your premium tax, which is not included. We don't require a reserve development because our reserves are healthy. And that also results in not needing the type of claims margin that an insurance carrier would need. And then finally, we also do not include any of the ACA fees that we pay on behalf of our members. That is paid out of the reserves, not in the pool needed amount. So that at the end of the day, the pool amount has a lower starting point than a typical insurance carrier would have because of those things that I just spoke to.
Okay, so we have the pool needed amount. We know what we're going to need to collect for the next year. Then how do we decide what renewal each individual county or district is going to get?
Charlotte, once the overall amount is determined, then we review each group individually in setting that renewal rate. So there's a number of components that are considered as part of that. We're looking at the group's credibility, which is determined by the size of the group, and it tells us how predictable that group's claims are. We look at the claims loss ratio. That's taking the paid claims divided by the contributions to get that loss ratio. We also look at high cost claims to determine what claims may be ongoing as opposed to what claims may be shocked out, or another term for that is the claims over the pooling point that should be not included in setting that renewal rate. And we also consider the factors that include the demographic, which is the age of the population, and the medical or area factor, which is looking at the cost of carrying that area. The model that we use in the pool is kind of a blended approach in which, depending on the group size, again, their credibility, how easy it is to predict their claims, we use more experience for the larger claims that are credible, and then it's a blended approach down to the smallest of claims that aren't credible, and we're using the factors to set that rate. So we look at each county individually based on the pool needed amount as the starting point in setting the individual group's renewal.
All right, Brian, tell us a little bit about how the pool's been performing over the past year and a half or so.
Well, we're having a really good plan year 19. Of course, when I say plan year 19, that means starting 10/1 of 2018. And we've added 4 new groups: Carson, Crane, Star, and Zavala. That puts us at a membership number of about 36,500 lives in the pool, not counting our self-funded groups. So we had a growth in membership in the pool of about 8%. And that, when you talk about demographics, didn't impact the average age. Our average age for the employees still around 47.5 years of age, and the dependent lives average age is around 37. So when you look at how we've been performing for plan year 2019, you want to look at the trend and what the current trend may be. First, let me remind you that last year at this time when we were having the renewal, we had projected 6% medical trend, and we're actually performing, as you can see, around 2.3% overall. We had a slight drop in demographics, so we added, as I said, about 8% membership, but that demographic remains stable. What we really are benefiting from is a drop in high-cost claimants, not because we're having a stellar year this year, but because the previous year was really so bad. And so we're regressing back to the norm from a high-cost claimant perspective, which is helping us. We are seeing increased utilization, which means our members are using the doctor and the hospitals more. That's not necessarily a bad thing if they're going in for their preventive care, which we're encouraging through Healthy County. And it's overall leading to a 2.3% medical trend, outperforming what we have projected. As we look at the pharmacy trend, you'll see that we're trending at 11%. The primary driver behind that 11% trend is our specialty trend at 30%. It's not uncommon for specialty trend to be the primary contributor to the pharmacy spend, but what is not good is that we've got an 11% trend. As I mentioned with the medical, we were projecting a 6% trend and it's around 2. As you look at pharmacy, we were projecting an 8% trend and it's at 11. And the increase in new to market drugs is not going to let up. And so this is primarily what led to one of the reasons why we had to look at a PBM change.
Well, Brian, what has been the effect of the PBM change?
We're seeing good results from the pharmacy benefit manager change. We had projected a 10% reduction in cost, and it's really outperforming that. And you'll see in the pharmacy trend since October, we have a -2% trend, and we have a nearly flat specialty drug trend, whereas with the prior carrier, we were looking at nearly a 30% specialty drug trend. So the numbers are moving in the right direction. We're happy to see that. We do recognize that there were going to be disruption in making the change. It's not easy to make a change when you're moving a PBM or you're moving the medical carrier. We did account for there to be a 90-day period where people would be getting used to our new pharmacy benefit manager. We had grandfathered drugs to allow members to make that change. But again, we're happy with the results we're seeing both in the trend and in the savings. So overall, what we're seeing at this point is an annualized savings of nearly $20 million. That's on close to an $80 million pharmacy spend. So we're seeing close to 25 to 30% reduction in pharmacy. That's having a significant impact on the overall loss ratio when you consider that pharmacy spend is about 25% of the total spend. We've decreased the average cost per script. We've increased the number of scripts at retail for your Retail 90. We removed the barrier of limiting members only to a CVS pharmacy to get their 90-day mail order supply. And now they can go to any retail pharmacy, which that has resulted in an increased number of Retail 90 scripts. All positive results, and we'll continue to monitor the savings from this change and the effect that that is having on the plan.
So we had a lot of changes into plan year 2019. We added the MD Live telehealth benefit for a $10 copay. We added the Arosty, or changed the Arosty benefit to utilize just an office visit copay. And we added voluntary vision. And then, of course, as Brian's been talking about, we did make a change to the pharmacy benefit manager. So how has all this impacted us? How are we looking now? We're about halfway into plan year 2019.
We're really looking good. And I'd like to start with, when we look at that pool needed amount, as we've been talking about, and setting the rates, we're looking at claims through April of 2019. So when you look at the loss ratio for the last 12 months ending April of 2019, we're right under our targeted rate of 94%. We're right at 92. 7 of the last 12 months have been under that targeted loss ratio. And you can see when looking at these numbers here, the significant drop that the pharmacy benefit manager change has had on that trend, or I should say on that loss ratio. We were ticking in the high 90s, eclipsing 100% loss ratio up until September, up until the PBM change. And so it's had a big impact and a positive impact on the way we're performing. I don't want to give all of the credit to the PBM change because, as you mentioned, some of the new programs we're seeing have a positive effect. We have members registering for MD Live. We have members utilizing MD Live, and we know that the cost for MD Live is significantly less than the cost of seeing a doctor or going for urgent care. And that has had a positive impact on the medical claims, as had some of the other programs like Naturally Slim.
All right, Brian, so now the burning question everyone's waiting for the answer to. what do we think is going to happen for plan year 2020?
Right. So that is a good question, and I want to back up just a little bit. Remind everybody that we have been performing well. We've been talking about a 2% medical trend. We're talking about a negative 2% on pharmacy since the pharmacy benefit manager change and the impact that some of these new programs are having. You'll also have to take into account the benefit plan changes. We had more benefit plan changes for plan year 19 than we've had historically. So you have to adjust for those benefit plan changes. That's going to have a positive impact on your claims. So what you get to is the underlying trend. What are medical costs increasing by for plan year 20? And what we're projecting is an 8% medical trend, and we're projecting a 6% pharmacy trend. The blended impact of that is 7.5. Again, as I mentioned, pharmacy accounts for about 25% of our total cost. And so when you blend those two numbers, we've got a 7.5% trend. That leads to, when you take in all of those things into account, again, as we said, how the claims are performing, what our fixed costs look like, what are the adjustments in the programs, what is the trend looking like. We set a needed amount. That needed amount for the pool was 2.79% overall for all of our groups. A very good number. It's slightly lower than the number that we needed last year. We take that number to the board, and we present that overall needed amount to the board, and they have approved it. So what we're doing now is putting together the renewal packages reflecting that overall needed amount of 2.79%. And as we discussed, not everybody's getting a 2.79. We look at everybody individually, and we look at their own performance. Some are performing better than that targeted loss ratio, and they're going to get better than that 2.79. Some are performing not as expected, and they'll get a slightly higher increase than the 2.79. And we expect those renewals to be going out around mid-June.
Great. Well, that's not bad at all. It's not bad at all. We're going to switch gears now, though. We're going to talk then about those renewal packets. Most of you have seen these before. We are making an effort this year to get them out to you a little bit earlier for the October 1 groups, because we recognize that some of our groups do struggle with getting those turned around in time to get back to us so that we can get it all processed and ready to go. So Lisa is going to talk to us now about the calendars. Can you talk to us a little bit about that October 1
Sure.
groups?
Thank you, Charlotte. As Brian mentioned, our board met on May 31st and approved all of our renewals. And since most all of our groups are October 1st renewals, we're going to take a few minutes now just to kind of review the calendars. Everyone will receive their own renewal group calendar in your renewal packet when those are emailed out to each of you. Our groups have been asking for renewals earlier, so the good news is that this year we're getting the October renewals out several weeks earlier than in previous years. All renewal packets will be emailed to the contracting authority and the primary contact that we have listed on file for your group. All October renewals are due back to TAC HEBP before August 2nd. Our October renewal groups need to complete their RMBC information online in OASIS before August 2nd. This is so that we can have everyone's open enrollment window in OASIS ready on time for early September. There's a tremendous amount of preparation, reviewing, double checking, programming, and testing, and then more testing that your HEBP staff does behind the scenes to make sure that your renewal and open enrollment entries in OASIS go smoothly. Our motto for this year is Plan Year 2020 renewals online and on time. So if you're a November, December, or January renewal, please keep in mind that your renewal packets will be emailed out to you. There is a copy of each of the renewal calendars in your slide presentation from today.
And we would like for you also to go ahead and plan, especially the October groups, but everyone, take a look at your calendars and go ahead and plan on which commissioner's court or board agenda you want to put this on so that you can be ready to move and get the decisions made and get your paperwork back in on time. Although I used the wrong word, I said paperwork. We want it online and on time. All right. So now Lisa's going to talk to us about some OASIS updates.
Yes, we have some more updates to OASIS this year. So in early July, Charlotte, we're going to have some big changes coming to OASIS with some security updates. This is going to require for HEBP to adapt a multi-factor authentication or MFA login.
It's hard to say.
It is. The MFA process is similar to when you log onto your bank account or any other secure online accounts, which many of you will probably be used to. The new MFA login process requires that you verify who you are before you log into OASIS. Because OASIS contains protected information, all of our OASIS users, as well as employees using the employee self-service, will be required to use the MFA login to securely log in to OASIS as of early July. The new login for OASIS will look a little bit different, but the URL address or the web address will remain the same. So you don't have to change the web address on your computer for OASIS. However, you will be required to enter the email address that's registered with TAC HEBP on your OASIS user agreement. So prior to this change for the OASIS login, we'll be sending out an instructional email going out to all of the registered OASIS users that will give you your email address that we have linked to your OASIS login account. Included in the presentation for today, we've got some step-by-step instructional or screenshots where you can see exactly each step that the OASIS user as well as the employees logging into the ESS will need to take in order to log into the system.
Okay, to get that set up. That sounds great.
Correct. So we do have some additional updates to OASIS. These are around entering new hires into the system. We have some fields that we're going to now be required when you enter a new employee into OASIS. The first one is that you will be required to enter a valid email address when you enter a new employee. There will be an email address field that you will enter the email address. It can be their personal email address or it can be their work email address. But make sure you enter that when you're entering the new hire information.
Lisa, what happens if you have an employee that says, I don't have an email address? Are those people, what year is it?
Who doesn't have
Who
an
doesn't have
email address?
But
they can always get a free email account through Gmail or Hotmail,
Yahoo, there's a bunch.
anything like that. So they can register for an email address and use that email address, and that can be entered in the new hire information. The second addition that we have to the new hire screen is that we're going to be capturing the employee classification code or the workers' compensation code that you use in your payroll system. There'll be a drop-down box where when you enter the new hire information, you'll just click on the employee classification code and move forward. Lastly, we're going to have an optional field. This one isn't required, but it is an optional field because most everybody has a cell phone. If they don't have an email address, I know they got a cell phone, but you will be able to enter their mobile number in the new hire information as well.
So back up just a second. You mentioned that we're going to be collecting now on new hires. We're calling it the employee classification, also known as the workers' comp code.
Right.
What about the people who are already in OASIS? How are we going to get that information? And also, what are we using that for?
That's a great question, Charlotte. So for all of your current employees in OASIS, later this fall, we'll send out a request to each group. All you have to do is send us a list from your payroll system that has those workers' compensation classification codes on it. Just send that list back to us here at TAC, and our staff,
Preferably in an Excel file.
our
rather
staff
than a
here at TAC
report.
is going to enter all of those codes for all current records in OASIS. So we will take care of entering all that information for all the current employees. What we're going to be using that information for is we're going to just use that for some analytics and claims data so that when Brian looks at claims, we can determine are there particular classification codes where we're seeing more musculoskeletal or different types of claims in those particular codes.
So that'll help us with the wellness.
Absolutely. It'll help us get more laser focused with recommendations from our wellness consultants around programs that we can put in place for the county. And it could just be focused on our jailers or just with our road and bridge, depending on what we're seeing in the claims data now that we'd be able to slice and dice it a little bit deeper.
So we've talked about OASIS for a bit. We're going to move on now into the renewal notice and benefit confirmation, the RNBC. You've heard it referred to probably a few times already today. The RNBC comes to you on paper in your renewal packet along with your 12-month claims versus contributions report, your high-cost claimant report. It's all a part of that packet, but as Lisa mentioned earlier, we're encouraging everyone to use the feature that was added last year where you can complete your RNBC online once your court or board has voted on what your benefit plans will be for the next year. We do have this year, though, a new addition to that process for you that I think everybody is going to like. I think it's going to save you some time, save our consultants some time, make that process go a little more quickly, and that is the ability to look at alternate plans and pricing online through that same OASIS section. You'll be able to look at alternate plans and print those out, bring them to your court to look at so that you're not waiting if you decide that you do want to look at something maybe a little different. Lisa's going to talk a little bit more about what that looks like.
So here you see the alternate renewal information tab. This is the new tab that's available in the RNBC tab. This tab is going to allow you to view and print your alternates that are available for your group's current medical and RX plans. It's going to show you the multiple options, including the benefits and the rates adjusted for each alternate medical or RX plan available. An example of an alternate would be if you currently have a medical plan 800, you would click on the alternate renewal information tab, the new tab on the right, and you'd automatically see alternate options for an 800G and an 800G2 medical plans and the correlating RX plans that go along with that. If your group votes on an alternate, then you can just print the alternate information. You would submit it online and it will adjust your RNBC, the actual renewal paperwork for you to be completed online, and that's what you would send in to TAC HEBP for your renewal. Well, we'll have detailed instructions included in your renewal packets on how to view the alternates online, how to submit the alternate plans, and complete the alternate RNBCs online in OASIS. For those of you who are new to the process of completing your RNBC or your renewal information online, we will have step-by-step screenshots in the presentation to walk you through each section of completing that RNBC online. Just remember, our motto this year is to turn in your renewal online and on time.
All right. I'm going to get tired of hearing that, but it's really super important to do that. Just it makes it go smoothly, and you'll hear from Brian a little bit later about one more reason why it's going to be super important this year. Well, next, we're moving on into another new update, another exciting update that we hope will save you all, those of you who handle benefits for your county or district, save you all some time and aggravation.
Yes. So we currently have our employee self-service portal, or the ESS, at mybenefits.county.org. And employees currently log in to this portal. They can review their benefits, they can review their dependents, their beneficiaries, they can review all of their information online. We have links to their Blue Cross account or their BAM account. We have links to Navitus. There's a link to Sonic Boom. They can get into their wellness program from there. But we're doing a large upgrade and overhaul of the ESS system, which will be rolling out this fall. And one of the upgrades to this is that we will have the ability to use the ESS as an open enrollment tool. We are really excited to offer this new ESS portal as an open enrollment tool for your group. Your employees can review their information, make updates and/or changes to their information, make open enrollment elections for themselves and their dependents, as well as enroll in any eligible benefits all online in one place through the new and improved ESS. Since the ESS is real-time and it's linked directly to Oasis, all updates will automatically update the employees and/or the dependents' records in Oasis. So this means that you will not have to go in and enter their open enrollment elections in Oasis. They will be entering it themselves through the ESS portal.
So Lisa, you mentioned that the employees will be able to use this during open enrollment to make changes, but for the rest of the year, they'll also be able to go in and see their information, maybe make address changes or that beneficiary changes, that sort of thing. What about new hires?
So on a new hire, the county would go into the system in Oasis and enter the basic information for the new employee, and then they would give the employee the window to log into the ESS and update their information. They can make their elections, they can add dependents, and all of that will automatically be updated on their record in Oasis.
And the benefits administrator then would get that report so they can set up the
Absolutely.
payroll, any payroll deductions or
Right.
whatever might be needed.
So
Okay.
throughout the year, they would get the notification that their report, their new hire report, would be ready, and they would log on to Oasis and check their report.
Okay.
So in early July, the employee self-service portal login will also change along with the Oasis user login. And the employees, when they log into the ESS, will be required to use the multi-factor authentication security in order to log into ESS to see their information. They could still log into the ESS, the same URL at mybenefits.county.org. It's just going to look a little bit different. We will be sending out postcards in early June to all Oasis users as well as all employees with the step-by-step instructions on how to log in and use the new MFA security.
Yes, it does. It seems a little cumbersome at first, but unfortunately, that's just the world that we live in. We have people's personal health information, and we've got to make sure that we're doing everything we can to keep that information secure. So now we've gotten a lot of information from Lisa about Oasis and RNBCs and ESSs and all of that, but we're going to move back to Brian now, who's going to talk about just a few more items coming up in this renewal and going forward for the pool.
Yes, we have some exciting news. We have listened to you all, and we will now have an annual open enrollment for dental. We heard year after year that this is something that you want us to have. You see it in the marketplace, so we took it to our board and they approved it. So you will now be able to enroll any full-time benefits eligible employees and eligible spouses and dependents annually during our open enrollment period for dental. We are also moving to a single phone number to better support our members in an effort to better serve them. Blue Cross is moving from all of the numbers you see on the back of their ID card to a single toll-free number. That doesn't eliminate all numbers because we still have the Navitist pharmacy benefit manager on the back of that ID card, but it does mean reissuing ID cards. So in late September, our members will be getting a new ID card, and the primary change you're going to see again is when you flip it on the back, we've got a single number to support you from a customer service support number.
Right. Now, they'll be going out in late September for everyone. The only exception to that might be if your group makes a plan change later than the point at which those ID cards are sent. They might, I think this happened to some people last year too, but you might get 2 sets depending on the timing of the renewal, but just be looking for that one number on the back for all of the Blue Cross customer service.
Yeah, a very good point. And also something to keep an eye out for are changes that we're making to the Blue Care Connection program. Blue Cross is making enhancements to that disease and well-being management program, taking a more holistic approach. So there will be future communications going to our members around that change to our well-being management platform.
All right. And then I think there's one more change that you have to talk about, another one that we're pretty excited about from Lisa's side of the house. I think she's excited. I'm excited.
Yes.
I think it's going to be awesome.
Our group spoke and we listened. Groups will now be able to pay their monthly invoices to TAC HEBP via ACH, and we hope to have this up and running by early 2020, if not sooner. We will be sending out detailed instructions on we will be accepting these payments and the elements that we'll need on those transactions. And then lastly, we will require that if you are going to pay your monthly invoice via ACH, you pay that invoice exactly as billed or pay as billed.
So we just want to remind you that you will need to send in your renewal by your due date, please, on or before. Before is even better. And the dates you're seeing here, the reminders of the renewal dates for each of your anniversary dates. And so one more time, we want you to send in your renewal online
and on time.
In an effort to better serve you, our members, we've added a fifth territory. We also intentionally hired consultants who live and work in their territory. The goal is to make our consultants more accessible to you, our members. While the consultants are on the road, your employee benefit specialists are your day-to-day contacts.
All right. Well, that was a lot of information. Thank you all for sticking with us through all of that. And thank you, Brian and Lisa, for the information. Hopefully you've gotten some things to think about and things to look forward to.